point in our lives, hospitals can be dangerous places. Medical experts say anything from pneumonia to bad reactions to medications can happen during a hospital stay for 12 out of every 100 patients.
So what can you do to protect yourself while receiving medical care? Leslie Michelson is the author of a new book titled The Patient's Playbook: How to Save Your Life and the Lives of Those You Love. He's here with the 6 steps we can take to stay alive and healthy in the hospital. It's hard to believe. First of all, welcome. It's hard to believe that we need something like this for the hospital.
You know, it's true. Hospitals are life-saving institutions, staffed by compassionate and hardworking, dedicated physicians and nurses who save lives every day. But what they do is so complex, mistakes get made. Institute of Medicine report showed that on average, every inpatient in the hospital will have a medical error every day.
Wow.
Yeah.
That is scary. You talk about 6 steps to stay healthy and alive in the hospital. Let's get to some of them. Number 1, specifically, review your own medical chart.
Absolutely.
Why is that so important?
You're entitled to review your medical chart, and you're the only one who can make sure it's entirely accurate. Make sure your name is spelled right, that the other diseases that you have are listed, the medications you're on, the emergency contact, and any allergies you have. Your physicians, your nurses will need that information to make sure they don't make mistakes on you, and you're the only person who can ensure it's accurate.
And it's a second step, post your medical information. Is that what you're talking about, or is that something else?
It's the next step, which is you're in a bed in a room. There's a lot of beds and a lot of rooms. In many hospitals today, there's a whiteboard, and if it's not there, take a piece of paper, put down your name, contact information, the information I just talked about, post it next to your bed so anybody coming in knows what they need to know about you to make sure you're getting the best care.
You say to not be afraid to monitor everything. What are we talking in terms of everything?
You need to be a hawk. If there's a change in the medication that you're being prescribed, ask about it, because mistakes happen every day. Did my attending physician prescribe this? If you're being scheduled for a procedure that no one's discussed with you, it might be for the person in the other bed in the room. Ask questions. Be polite, but be assertive and be a participant.
At what point, though, because sometimes, like, you may have 4 different specialty doctors coming. And I was in a situation where they'd come and say, well, what's the name say? And I said, I don't know, I can't remember, and I can't, you know, at what point do you all of a sudden start interfering?
Well, it's not interfering if you do it respectfully and responsibly. And in the patient playbook, I give people, we model the kinds of conversations that you can have. I deal with physicians and nurses every day, and they all tell me the same thing. We don't have the resources, we don't have the time that we'd want to give people the care that they deserve and we know they need. So what I encourage everybody to do is bring a quarterback with them to the hospital. A family member, a friend, who can be your partner, because you're going to be tired, you're going to be vulnerable. You'll be under medications that keep you from being at the top of your game. You need to have a healthcare partner who becomes part of your care team.
That was one step. The one before is report your symptoms.
Right.
And don't they already know my symptoms?
Well, they may. But remember, nurses change out with staff changes. Different specialists come in to see you. It's hard for them to keep track of everything. But you know, people are very in touch with their bodies. If there's something that's changed in your body, make sure that your caregivers know so they have the benefit of that information and they can be at the top of their game. Become their partner.
And that 6th step, you say, is once you're discharged, you need instructions. The care doesn't stop there.
Right. It's a very complicated thing that happens in a hospital. One of the problems that this data show is that 30% of Medicare patients who are discharged from a hospital end up being readmitted within 30 days. And one of the reasons is they don't get good discharge instructions. So when it's time to leave the hospital, there's always an opportunity to ask your physicians, ask your nurses, to give you discharge instructions. Make sure you know what the diagnosis is, what the treatment was, what medications you're on, what to look for, what to do, what not to do, and importantly, who to call if there's a problem. If you get those things and follow them, you're much less likely to get readmitted.
Really good information. I want to tell folks we've posted all 6 of the steps, the tips, on our website, KTLA.com. And you can meet Leslie Michelson at a book signing and discussion next Wednesday, October 14th at the Barnes & Noble in Santa Monica. For more information, go to patientsplaybook.com. Again, thanks for coming in.
Thank you so much.
Leslie.
I'm very appreciative.
Appreciate it.